Hello everyone and welcome. Happy Friday. I can't believe it is Friday. For those of you who don't know me, my name is Dr. Bridget Young. I'm founder of babyformulaexpert.com. I'm a doctor of perinatal nutrition and a certified lactation counselor. And today we're going to be talking about a very well-timed topic of some feeding tips to help keep your baby safe from a potential infection. Obviously, this is inspired by our current kind of scary situation of the COVID-19 pandemic. I'm in New York, so we are in a state of emergency. I spent the whole day, our hospital is totally prepared and ready to go, but it seems to be all that anyone's talking, at least on Instagram, for sure. So I wanted to give you some feeding tips, since my expertise is in feeding tips to help keep your baby healthy. And I want to be really clear before I say anything else. So I just told you I'm a doctor of perinatal nutrition. That means I have a PhD. I am not an MD. So I'm going to be giving you tips that I consider informed tips of things that I would be doing in my own home if my babies were still actually babies. They're toddlers now. So I have a good understanding of molecular biology and I minored in epidemiology, but this is not formal advice, and I'm not pretending this will prevent infection in your home, but these are things that you can do so that you know you're doing your very best to help keep your baby from being accidentally exposed to either coronavirus from you if you happen to have it, or any other germs in your house through feeding. So now that I kind of have that disclaimer out of the way, let's get started. My kids are in bed, so I am having a lovely Cabernet Franc, and it is fantastic. So I'm going to be giving you some tips that honestly, when we're feeding infants, we probably should be doing all of the time, but that we get a little lax on. So now is a really good time to improve our practices because we're really all highly motivated to keep ourselves safe. But of course, we're always more motivated to keep our children safe. So let's get started. So first thing we need to understand about the coronavirus, or the COVID-19 is more accurate of the specific strain, how it is transmitted, because if we understand that, then we can prevent potential transmission. So what we know, there's a lot we don't know about COVID-19 right now, but what we do know is that we think the major transmission is through droplets into mucous membranes. So another way of saying that is droplets like from a cough or a sneeze, which is a bummer because this is a respiratory virus, so it causes people to cough a lot. So virus particles come out of your mouth, a person who's infected, and then they enter a mucous membrane of someone who's not, like your eyes, your nose, your mouth. So this is why everyone's saying stop touching your face, which we all do all the time. If you happen to get germs on your hands, you rub your eyes, you pick your nose, you can expose yourself that way. So that's why people keep saying stop touching your face. So understanding that, we can understand potential infectious routes through which our babies could be exposed. Another thing I want to point out is, so far, from what we know, it doesn't seem like babies and young children are particularly vulnerable. That's not to say they won't get sick, but they don't seem particularly targeted by this virus, which is awesome news. I find it very comforting as a mother of young children myself, but that doesn't mean we're going to be any less vigilant in trying to keep them safe and protected. So let's go through some tips and maybe some tweaks hopefully you can make to your feeding routine so you can feel really confident that you're being as safe as possible. Number one, this is not going to surprise you, wash your hands. Wash your hands all the time. Wash your hands all the normal times you would wash your hands, and if possible, before touching your infant. I actually read that on a CDC thing. Like, wash your hands before touching your infant. I'm like, have you ever met a mother? Do you think she only touches her infant 3 times a day? They're like one body. That's kind of ridiculous advice, but try your best. A particular thing you can do is if you are ever returning to your infant, either to a caregiver or returning home to your infant, anytime you are re-entering an environment with your infant, it would be particularly important to wash your hands, ideally before handling them. And wash your hands well, sing happy birthday slowly, get in all the nooks and crannies, kind of goes back to kindergarten training. So I have toddlers and we're like really into learning how to wash our hands. And so I like sing their little song that I sing to them in my head when I wash my hands. And it's made me realize how bad I've been at washing my hands until now. But I'm really good at it right now, trying to keep everybody safe. So wash your hands all the time. Wash your hands, especially when returning to your infant if you have been away and, potentially exposed to any germs, but the virus in a new environment. All right. So that's kind of obvious. Now some tips for formula feeding and formula preparation that can help keep your baby safe. Number one, wash your hands. Wash your hands before preparing formula. Formula in the beginning of the day, formula in a bottle. Anytime you're prepping a feed, wash your hands before you begin. And then I'm going to give you some tips in a lab, we call this sterile technique, to try to prepare formula as sterilely as possible, or to minimize getting any kind of pathogens, virus or bacterial, into the formula. So first, wash your hands. That's hopefully going to clean anything off of your hands. And then I want you to imagine yourself as a filthy, infectious being. I actually tell students who come into my lab this. So remember the Peanuts character who had like the cloud of dirt and dust around him all the time? I want you to imagine yourself as that, because we really are. We're covered in bacteria, and we all could have coronavirus. Most people don't show symptoms and they handle it just fine. So kind of imagine yourself as being filthy. And as you're talking or sneezing or breathing, particles are coming out of your mouth and they're filling the air. So imagine that, and that will help you to improve your sterile technique. So first you've washed your hands, and then hopefully you're preparing formula on a counter or some kind of washable surface. If you were able to get some, use a Clorox wipe or something to clean the counter. If you don't have any disinfectant available because it's sold out everywhere, just clean the counter so that you're not preparing the formula on a dirty surface. And then here are some tips to preparing formula as safely as possible. I don't have formula in my house anymore because my babies are so old. This is my collagen protein, but it comes with a scoop, so I'm going to use it. So we're preparing our formula. I've washed my hands. I've cleaned the surface. Now I'm going to open the can. Here's what I'm not going to do. Put it right under my face. Put it right down here, because remember, I'm spewing germs everywhere. So you set it a little bit off to the side so you're not breathing over the open can. You take the lid. You put it on your clean surface, lid up, so that if there are any germs on the counter, you're not putting the lid on top of the counter, which can potentially get germs into the inside of the container. So you take the lid, you put it lid up, away from where your mouth is facing. You have your formula container that you're also going to set offside from where you're breathing. And then you're going to get out the scoop. I want you, can you see this at all? Hopefully your scoop is having the handle straight up. So basically not buried, because now I'm going to take my hand. I did just clean it, but imagine you're filthy. You're going to put your hand in there and you just want to be able to barely grab the scoop. You don't want to have to dig around. And then, you'll get your scoop, even it out. This is not a formula prep, so you want, a nice even scoop. If your formula scoop is buried, like maybe the can fell on its side or something, that happens to all of us, do not stick your fingers in there to dig around. Get a clean knife from your cutlery drawer and kind of fish the scoop out and shake it until you can get just the handle sticking up. So then you have your formula off to the side, you get your scoop, so you're trying to touch as minimal as possible and you're not going to try to breathe. If you have to sneeze, for heaven's sakes, sneeze as far away from the open formula container as possible. So we're just making a 2-ounce bottle. So we got our 1 scoop and then we're going to put it back. When I put formula scoops back, I actually scoop up formula like this and then set it in. So the scoop is full. That way it stays weighted, and the scoop, the handle will stick up, ensuring that the next time you open it, you'll be able to just grab the handle with keeping potential exposure to the formula as minimal as possible. So we've scooped out our formula. We're gonna take our lid that was lit up and put it back on, screw it on. Now you don't have to worry about breathing your filth all in it. But those are tips that you can use that can actually probably dramatically decrease potential exposure of your formula, and then thus, of course, what your baby is drinking, to try to keep them as safe as possible. So like I said, we should be doing this all the time. Cold season, flu season, it's just now that we're all particularly motivated. So these are tips that can hopefully help prevent anything from getting your baby sick, but especially we're always so worried, like, oh my gosh, what if I have it, but I don't have symptoms, that kind of a thing. So using kind of a sterile technique will at least make you feel good that you're doing your absolute best when you're prepping your feeds to keep your baby as safe as possible. So that was relevant to just formula feeding moms. I've got a couple more tips to any type of infant, formula, breastfeeding, any combo, again, that we should be doing all the time, but we get a little lax on. So pump, part, and bottle cleaning and storage. Anytime you use your breast pump, anytime you feed your baby a bottle, anything that is in contact with breast milk or formula that then will be fed to the baby should be washed very well. That's pretty common sense. Especially when we're all concerned about infection right now. try to sterilize as much as you can. Dishwasher's fine. So pump parts, bottles, etc., they can go in the top rack of the dishwasher if your dishwasher has a sterilization setting, which is great. There's also the sterilization bags you may have that you can probably order on Amazon and somebody will probably deliver to you still. So sterilize occasionally. At this point, CDC is not recommending that you need to, do any extra sterilization beyond normal practices. So sterilize, a couple times a week. Here's something that people don't often do, but can actually make a difference. When you're drying pump parts or bottles, so either if you have just washed them really well with soap and water and you're drying them, or they've come out of the dishwasher and they're really wet, you need to be drying them separately from your other dishes. So like in our house, we use a drying mat for dishes and stuff. That stuff can be teeming with bacteria. Now, currently, I do not know of any data about whether or not coronavirus can survive on a wet towel, or we just don't have that resolution. So let's just be really careful. So here's what you can do to be as safe as possible with any of your feeding materials. Dry them separately, either on, like those grass mats. Those are great. They were designed because there's airflow coming in and the bottle's not actually touching any kind of porous material like a towel. If you don't have one of those, fine. Use a clean paper towel on top of a clean surface. So like your clean counter where you just prepped your formula, clean paper towel, the bottle's on top, and then you throw that paper towel away. You don't reuse it. So clean paper towel every time you put on new bottles or pump parts. Here's something else nobody talks about, but I think is worth mentioning. Move the bottle or pump part drying station into a low visitation area of your kitchen. So I dry my dishes right where I wash them, and that's where there's a lot of activity. People are sneezing. Again, if people aren't even showing signs of illness, when you talk, imagine all the minuscule molecular spit particles coming out of your mouth, covering everything. So we want to minimize as much of that exposure to baby stuff as possible. So take your grass mat or your paper towel, whatever you're using to dry, and put it in a corner of your kitchen that's less visited. Yes, you'll have to take a couple more steps to go get it when you need it. But for right now, when we're all really nervous, it's totally worth the extra effort. So put it in a space where people aren't going to be sneezing or talking nearby. And also, it's not likely going to be splashed. When I had young children, I had my pump parts just everywhere, and I remember finding marinara sauce on them once because some sauce had boiled over, and I was like, this is the least clean, sterile thing I've ever seen in my life. Like, that is something you want to avoid. So move your stuff into a low germ area of the kitchen, or just like a low traffic area. So that's relevant to either pump parts or bottle parts, any bottle feeding apparatus, really. You're drying pacifiers, whatever, baby stuff, try to dry kind of in a secluded, clean area. And last, some tips just for mamas who are breastfeeding. If you are breastfeeding, the Academy of Breastfeeding Medicine and the CDC came out with a statement about COVID-19 relevant to breastfeeding and pumping mothers. So that's really, really helpful. So if you want to see the whole thing, just Google CDC COVID-19 breastfeeding and it will be the first hit. The punchline is, don't stop. Keep breastfeeding. I'll read you a little snippet that I think is the part that's particularly helpful, because everyone's worst case scenario is like, what if I actually get sick and I have my baby with me and now I have coronavirus? What do I do? How do I keep them safe? So they talk about that. A mother with confirmed COVID-19 or who is a symptomatic person under investigation. So like if you get put on quarantine, that mother should take all possible precaution to avoid spreading the virus to her infant, including washing her hands before touching the infant and wearing a face mask if possible, because we have a shortage, while feeding at the breast. And because you know that the virus is spread by particles, that makes sense. If the baby's feeding at the breast, they're very close to your mouth. So what you want to do is avoid sneezing on the baby, like gazing into the baby's eyes while they breastfeed, which is totally what you want to do. But so avoid potentially exposing them to your secretions, even molecular secretions like tiny spit particles that come out of your mouth when you're talking. So wear a mask if you have one. If you don't, just try your best to not actively sneeze on the baby if you have a confirmed case. If expressing breast milk with a manual or electric breast pump, again, this is for a confirmed COVID-19 mother, The mother should wash her hands before touching any pump or bottle parts, but we all should be doing that, and follow recommendations for proper pump cleaning after each use. We all should be doing that too. If possible, consider having someone who is well care for and feed the expressed breast milk to the infants. That's again a big if possible. So hopefully that's a very unusual situation, having a breastfeeding mother with a confirmed case under quarantine. But even in those situations, our current recommendation is keep breastfeeding. And there's a lot I didn't read, and a lot of the reasons to keep breastfeeding is breast milk is full of antimicrobial things, antibodies, like you could actually be potentially protecting your infant by breastfeeding. That's if we just don't know with COVID-19 yet. So these recommendations may change. If they do, I'll make another video. But for now, that is clearly only relevant to mothers who are breastfeeding, but is really helpful to know. So basically their punchline is just, do what you should be doing all the time anyway, which is wash your hands, use proper cleaning technique, and avoid sneezing on your baby if you're sick. Kind of common sense. So I'm going to end with, two last things. One, I was going to end with, you noticed wash your hands was the biggest thing. We still, our best defense is to just wash your hands and, no need to panic, but be appropriately cautious. So the last thing I want to end with, which is just totally my personal advice, is I think one of the best things you can do to keep your baby safe is to take care of yourself. So currently, adults seem to be much harder hit than children. Again, that's just current. So you getting enough sleep, remember to taking care of yourself mentally. Maybe that's not watching the news so much, protecting your mental health, doing deep breaths, eating nutritiously, keeping your body healthy is the best way that you're able to capably care for your baby, which will of course keep them safe. And mothers, I'm specifically talking to mothers, but all caregivers and babies have a very special bond. So the best way to keep them healthy is to keep you healthy. And if you're healthy, then you don't need to worry about inadvertently exposing them when prepping their formula or feeding them expressed breast milk. So remember that you can use your motivation to keep your baby safe as motivation to take care of yourself too. So this is a really scary time. I've been really, really humbled to see how unifying it's been for a lot of people. So I'm just trying to stay positive and see the good faith in humanity. And if there's anything else that I can help with, again, I'm not an MD, but these are just tips that we all should be doing anyway. But if we can get them into our habit now while we're particularly motivated, then it's just best practice to continue. So again, I hope that was helpful. I love you guys so much. I'll see you next week. So you can leave. I've got a couple comments here that I'm going to try to... Oh no, they're just nice. Thanks guys. Such nice comments. If there's any other particular questions about feeding prep, or any kind of thing like that come up when you're, of course, worried about potential infection, if you think I can help, put them in the comments. If I don't know, I'll try to find the answer for you or reach out to some other expert who's actually qualified to talk about it and get back to you. Okay. Have a wonderful, wonderful night and hang in there. We're all going to get through this. Bye.